So we're with us in Visible Reality, your heart.
I'm doing great.
How are
Thank
you
you.
doing
And you?
today? I'm doing well. I'm excited to have this conversation with you and ask you about what do you do in your clinic? Like you, what I saw in the
Uh-huh.
you have modalities other than
Right,
treatment with medication, and that's what the
right, right.
world needs right now.
I
Talk to
am
us
by
about that.
training a radiation oncologist. What I used to give, which I stopped last October, was radiation. It was not medication. Even though, in support of patients who are receiving radiation,
So
sometimes we needed to prescribe medications, but my main modality, my prescription was radiation for treatment of cancer. And the reason that I
okay.
left clinic a year ago is not that I do not believe in radiation. I think what Western medicine or allopathic medicine offers is good for treating acute phases of diseases. However, Western medicine or allopathic medicine does not address the root cause of issues. So when it comes to
Mhm.
chronic serious illnesses, Western medicine leaves a lot to be desired. And that is why I am doing two other modalities that are not considered medical treatments.
Yes, we
Yes.
still
So one
cap
is CAP
them,
or Kundalini
right?
Activation
Eh,
Process, and the other one is MAP or Make Anything Possible.
So talk to me about that. Because to be honest, I'm interested in other modalities than radiation, X-rays, just pharmaceutical medication. Because like you, I believe there are other reasons for the disease to come in the body, and we have to treat the root cause. But I no
Sure.
idea that one
So,
much.
just to give you a little background as how I arrived at these two modalities was for two reasons. One is that my field, oncology, is a field that, even though there's a lot of success in treatments, there are many moments that you have to look into a patient's eye and say, I have nothing to offer you. And that is extremely unpleasant for a physician because we entered this field because we want to help people. And when we feel that there's nothing we can do, it's a very helpless and unpleasant situation. So that was one of the reasons that, okay, what else is out there? The second was my own personal struggles. And my struggles were after more than a decade of childhood trauma and sexual abuse. I had developed treatment resistant depression, PTSD, and 30
Mhm.
years of insomnia. All the, yeah, go ahead.
And that I'm saying that's very common in the population. But the thing is, you had the knowledge to go and look for something else. Most of the people, they don't. They keep a cell phone medication, and insomnia is there, the anxiety is there,
Yes.
PTSD, you numb the
I did not have the luxury of numbing my feelings, even though I tried, because when you have insomnia for 30 years, it's so exhausting, it's so debilitating that you just have to do something about it. And obviously, as a physician trained with Western medicine, for years, up to 4 years ago, I was entirely dependent on what Western medicine had to offer me. And I tried everything. I was receiving therapy, multiple different therapists. I was on maximum doses of medications for depression, for insomnia, for anxiety. And I even went and did transcranial magnetic stimulation, which 4 years ago was one of the newest treatment for treatment resistant
Mhm.
depression. So I was do anything. I was like, okay, what else? What can I do? And it got to a point that literally my doctor looked at me and said, I don't have anything else to offer. And I literally sat on the bench outside of his office and cried. Because I'm like, okay, now what? Right. And that is when my journey of
Yeah.
seeking other modalities began. I even went as far as going to Brazil. If you have heard his name, John of God. I even went to John of God, right? And now he's in prison. But
No.
he was a healer and he
What does
didn't
he do?
do the healing. He was like a medium, channeling healers. So, despite the fact that the man
Okay.
is a fraud, but what he was doing was legitimate, but didn't do anything for me. So I just kept trying. And as a physician, I always ask, okay, what is the data, right? Show me research that show me phase 3, if not at least phase 2, if not at least phase 1 trials that showed this modality was effective before I give it a try. But I was so desperate that I was not asking for data. I'm like, whatever it is, I am trying because I need to sleep. And I tried tens of different modalities, pages I can write as what I try. And what not, it was not working. And I got to a
Mhm.
point that I'm like, I either have to end my life because I can't continue like this or find something. And I believe in universe offering you things. And both CAP and MAP showed up in my social medias. And I was like, okay, I'll try it. I'll give it a try.
Okay.
So these two kind of showed up at the same time. And they are slightly different. I'll try to explain. So, map or make anything possible is a modality, in my opinion, the most effective and the most efficient modality for treating childhood trauma. In
Mhm.
fact, in 6 sessions, my childhood trauma was neutralized. After failing 30 years of therapy, medication, 6 sessions of it neutralized my childhood trauma. So
Talk about
I
miracles.
decided I have to
I
become
believe
a
in more.
coach. For 30 years, I had not heard about this. None of my doctors told me anything about this. This is like a miracle, right? I need to learn. And when I became a coach, which took me, usually training is 7 months. I took my time. It took a year to get my certification. I learned that MAP can do a whole lot more than just neutralizing your traumas because it also has the capability of helping you create your goals, your dreams. So there's a positive aspect because when we have unhealed traumas,
Mhm.
that is all that occupies our mind, our emotions. All we are trying to do is that how can I sleep? How can I not be depressed, right? And in fact, at some point, my MAP coach, who is the founder of Make Anything Possible, her name is Colette Stryker, and she also resides in Houston. She asked me, what do you want to achieve? And the only thing I could think of was peace. I could not think of joy. Joy meant nothing to me. I was 4 years when my sexual abuse started. I had forgotten how it is to feel joy. I couldn't ask for it. I could not experience it. And I had no idea what bliss is. So I said, peace. I only want peace because my mind doesn't stop. It's constantly going. So when you have unhealed traumas, you don't think about, oh, I want to create this dream and I want to achieve this goal. I want to, you nothing. You just want to neutralize all the pain and suffering. But map also is an aspect that helps you create. Once you have neutralized your negative emotion, now this vast space that has become available to you and this vast energy that you're not wasting on struggling, you can channel this into something positive and can help you with that. That is why I became a MAP coach. And as I said, I do believe that by addressing childhood traumas in my patients, I'm helping them address the root cause of their disease. Radiation is fine for acute phase, but once you receive radiation,
Mhm.
an average radiation oncologist or oncologist, they do follow up. They see you every 3 months or 6 months, check scans, but nobody's like, okay, how did this even happen? Right. And next time they want to treat you is when the cancer has come back. I'm like, no, we need
Exactly.
to find out why and address the root cause so it
Mhm.
doesn't come back. So, once again, the reason I left clinic is that I think there are plenty of good radiation oncologists who can do that, but nobody else that I know of is offering this. So, I want to be that person. Now, in terms of CAP, Kundalini Activation Process, again, this showed up in my social media. And I was trying everything. I was trying anything and everything. And what Kundalini activation process is, it's awakening or activation of Kundalini energy that already resides in all of us, but it is not necessarily awakened or activated. Okay. Kundalini energy is life
What is
force
a
energy, what
energy?
has given us
Let me
life
ask
and
you.
has maintained our life. In different cultures, they have named it different things. Indians call it prana, Chinese call it chi, Christians call it Holy Spirit.
Okay.
My teacher, Venant Wong, calls it God. It's a divine energy. It's
Okay.
that piece of God that exists in us. And it knows us very intimately. It knows what we
Yes.
need.
Okay.
It knows how much of it we can receive. And because of that, it's an extremely safe modality. I have been doing this for 4 years. I have done more than 100 sessions. I always say the only side effect of CAT is betterment of your life. It has absolutely transformed my life. And well, I'm like, okay, I have to become a CAT facilitator too. However, with CAT, with mapping, also, I don't call these treatment medical treatments. Even though I, as an
Mm.
individual, not as a physician, I, as
Yes.
Noushin Izadifar Hart, believe that these are healing modalities. So, what CAP does by awakening life force
Yes.
energy with you, it literally opens all of the blockage in your energy system one by one, whether it's chakras or meridians, it unblocks. And by doing so, raises your vibration.
Mhm.
We human beings, like any other object or living creature, we are energy. That's all we are. And everything, every emotion, every
Mhm.
action, every state of our body has its own vibration. For example, sickness has a very low vibration. Health has a very high vibe. Happiness, gratitude, they have very high vibration. Anger, sadness, very low vibrations. Spontaneous healing is possible when you shift from a low vibration state to a high vibration state because you're literally not that person anymore.
Yeah, you have to be very, like, you have to mention
Intentions have
and
different vibrations, right?
monitor
So
also
I can
intention. It's
go
very hard.
and help a homeless person on the street discreetly,
Yes.
respectfully, with the intention of helping that
Mm.
person. That's all. Or I can go give them $100 and videotape it and put it on my Instagram, basically boosting my own ego. It's like, look at me, like, what a great person I am. Universe
Yeah.
doesn't look at your actions or thoughts or words. Universe has one
You
language,
know.
and that's frequency. Your intention has a frequency. If you do something with good
Mhm.
intention, the universe rewards you because it's a two-way street.
Oh,
You get reaction to your action. And if you are doing a high vibration action, you receive something high vibration. Now, for years after the movie Secret and all of that, manifestation has become this big thing, right? And what they tell you, oh, you have
yeah.
your vision board and you just imagine what you want,
Yes.
which is good and dandy. And then you write like a gratitude letter as if it has come true. Yeah, these are all good. But if your vibration and frequency is not at the level of what you want to receive, you will never receive it. You can write 500 gratitude letter and have 600 vision boards. If your frequency is not at the level of abundance and it is at the level of lack, you'll receive lack. It's just simple as that because the language of the universe.
Mm. Yeah. I I went through that. I had my vision board, I had my intentions, and for years nothing came. And I believe my frequency that is low
Yes.
with
Yes.
depression, the low and
What
anxiety that
simply
the
CAP
frequency goes low,
does,
and
it
that's where
raises
God
your
meant.
vibration.
Yeah.
And it's what is beautiful about CAP or Kundalini
Mhm.
Activation Process, which is a very specific modality of Kundalini. Because if you Google Kundalini, there are like 100 modalities with Kundalini in their name in Google. And there are two major differences between Kundalini Activation Process or CAP and any other modality with Kundalini name in it.
Mhm.
Kundalini breath, yoga, everything is fine with that, but it's effort based. You are trying, you're making an effort to activate your Kundalini energy either by
Yes.
breath or your yoga, whatever. You are in charge and you're trying. And we human beings are never content. We want things
Mm.
fast and we want more of it, right? There's a tendency for people to overdo it when their system is not ready. And because of
Yes.
that, you see a lot of things in the internet. Oh my God, I'm so
Mhm.
sorry. I regret activating my Kundalini. I'm going crazy. I can't stop it. All these things that makes people falsely believe that activating your Kundalini is going to result in you're going to be out of control and some really bad things are going to happen to you. No. Why? Because Kundalini activation process or CAP is an ease based process. All you do, you lay on a yoga mat or your bed or whatever. You just lay down, you close your eyes, and a CAP facilitator plays 60 to 90 minutes of a playlist that they have created. And it can be done online through Zoom or it can be done in person. If
Mhm.
it's in person,
Mhm.
the facilitator, with your permission, touches your chakras and your meridian
Mhm.
points and transmit their own activation because they are activated already. They transmit that activation to you. You're not doing anything. All you're doing, you're surrendering. You're closing your eyes and trusting the energy. The facilitator is not creating that energy. The energy is in you and in the facilitator. All they're doing is because they're activated, they're active energy. The facilitator is not in charge. The facilitator doesn't, so I'm going to give her one dose. I'm giving this one 5 doses. No, the energy is in charge. And because energy is in charge, it knows exactly how much your system can handle. And it never gives you more than what you can handle. Because of that, there's no side effect. Literally, there's no side effect. So it's ease based and it's 100% safe. And the end result is raising your vibration. When your vibration has been raised, and for the first time in my life, I have experienced true joy and true bliss, which I even didn't know there is such a thing. And what does it mean? It's really a state of samadhi that people go sit on the mountain for 10 years to achieve. You can achieve that through CAP without any act.
Yeah.
I have done it. Well, I
Have you
open my sessions to everybody,
done
but
that on
I recently was
as
in Toronto just last week and I did
your
a session on a patient with cancer. Again, I don't go there. I'm like, I'm going to heal your cancer and CAP is going to get rid of your cancer. No, we're just raising your vibrations. And because of that, cancer is a low vibration state. So you're going to go in a higher vibration state, which is health. So yes, I do use it for everybody, including patients.
Well, I remember you saying that the moment you realized to find something else when you were at your doctor's office and he said,
It was very difficult. It
"That's
was
it, I
life or
don't want."
death for me. It was literally life or
Um,
death.
so this
I
is a
had police at
pivotal
my
moment.
door because my friends and family were calling the police because I had told them I had planned it. I could not live like that anymore. It was just, I was extremely miserable, exhausted. Like, I cannot do this anymore. And when you get to that state of desperation, yes, it opens you up to try different things that there may be no data for it, but you're also very committed because you don't have any other option. The first 10 sessions of CAT, I did not feel a thing, nothing, right?
That's
And
true.
we human
Yeah.
look for proof. Like, oh, if something is not happening, means that the thing is not working, which is not true. But I could not have any proof that CAP is working for me. But I didn't quit. Why? Because I didn't have any other option. It's like, okay, I'll just keep going, right? But when you have many options, you may quit after
Yes.
one session. Like, no, this doesn't work. I'm not going to do it.
Yeah. I-
Can you?
so
I,
I'm
I
very,
have a
very
little bit
scientific.
echo still. Can
I
you
do
tell me?
hypnotherapy with Dr. Tony Ripley. You know, she talked about 1 second.
Lipton?
So I'm saying I'm
Oh, Gupta.
doing
Got it. Got it. Okay.
hypnotherapy
Okay. Okay.
sessions with Doctor. Yeah, yeah.
Yeah.
I go
Right.
through it and I feel great, but my mind is still thinking, I'm
Right.
like, how is that possible? You know, I think the scientific background plays a big role. So sorry. I want you.
It had positive
How
and
do
negative
medical back
uh
shape
causes
your
or contribution.
perspective
The negative is
on that?
always like the mind because I was a very, and I still am to some degree, analytic kind of person, right? I have to understand it. I have to have proof. There has to be research. I used to say, in God we trust. Everybody
Mhm.
else needs data, right? If you don't have data, don't talk to me. You're not God, right? So that was the downside of it until in my own personal life, I got to, I mean,
Yes.
as a physician, you look at a
Yeah.
patient who is using, I don't know, shark cartilage. And we used to be very judgmental. So she's out of her mind, you know. But when people are desperate, when you don't have anything to
Mhm.
offer them and they want to live, they're willing to try everything. And when I got to that position in my personal life, I realized, like any other human being, I am willing to try everything. And that gave me a much better understanding of what my patients are going through, becoming less judgmental about them. Yeah, they are seeking health. They're going to try everything. They're not giving up, which is a positive aspect, right? Now that I'm on the other side of it, that I'm not only have benefited from modalities that there's no data to support, but also I'm offering them. Now I have started doing research on them because, not because I need proof, the proof is in the pudding. I'm a completely different person, no therapy, off all medications, sleep like a baby, have been the most happiest ever in my life, have been experiencing a state of mind like bliss that I never knew what it was. I don't need proof. I am the truth, right? But the language of my colleagues are the language of science. I can go tell them my story 15 times. They're going to
That's
say,
true.
this is called anecdotal. This is one person. It could be placebo effect.
Mhm.
There's no proof that these things work, right? So I want to speak to them with the language they understand, and that
Mhm.
is research. So I want to do research on CAP. I
Mm.
want to do research on math. So I can show them, look, there is data. This is objective changes that I have created in my patient.
Yes. We actually need that is kind of proof because as a physician, I know how they think. Even if I try like explain for them,
You know,
they would be like,
placebo
she's
is
going cuckoo,
successful in
I'm like, no, it
30%
works.
of times. That's a
But
huge
we really need
number. You
research.
can
I'm
have a
glad you're
sugar
thinking that.
pill, and three out of, a third of people are going to get better. That's really
That's
scary when it comes to any modality that is making changes in people's life, because it could very well be placebo effect. Up to 30% of it is placebo effect, right? So I think it's important to create research, but it is also understandable. Somebody like me 4 years ago did not have the luxury or
yes.
time to wait for research. I had to try. Of course, I accepted any potential risk. I accepted this may not work like any 40 other modalities I have tried, but I needed to sleep. I needed to live, and I didn't have time to wait for research. Now I do understand people wanting to try modalities that there's no research because time is of essence. But I also believe that, like some people say, why research? You're recreating the wheel, and like, why research? But because that's the only language they understand.
Exactly. And what I'm thinking, or like the people I think those modalities has to go hand by hand with the medication and modern medicine to work best. Anything alone wouldn't work, to be honest. And I wanted to ask you another question. I wrote
Can
it
you
down.
repeat your question? The echo
What
doesn't
are
let
the
me hear.
that are fit for you in different modalities other than prescription medicine? Okay, I'll stop the video and then try to solve the